Every single day, millions of seniors across America reach into their medicine cabinet, grab a handful of vitamins, and swallow them, believing they're doing the right thing for their health. And most of the time, their own doctor told them to take those vitamins. But here's what almost nobody is talking about. What almost nobody is warning you about. Certain vitamins that are perfectly fine for a 40-year-old can become genuinely dangerous once you pass the age of 60. Not because the vitamins themselves changed, but because your body changed. Your kidneys work differently. Your liver processes things more slowly. Your heart is more sensitive. Your bones respond differently. And when you combine certain popular supplements with the medications most seniors are already taking, the result can be catastrophic. I've been in practice long enough to see patients end up in the emergency room, not because of a disease, not because of an accident, but because of vitamins they were taking every single morning, thinking they were protecting their health. And the most heartbreaking part? They had no idea. So today, I'm going to walk you through the 5 vitamins that can become dangerous after 60, the ones I see causing real harm in real patients. Some of these are going to shock you. A couple of them are vitamins your doctor may have recommended to you. But there is crucial information about dosage, timing, and interactions that most people are never told. Stay with me through this entire video, because the 5th one on this list is the one that surprises people the most. And it may be sitting in your cabinet right now. I'm Dr. William. I've spent decades working with patients, particularly older adults, managing everything from heart disease and diabetes to bone health and cognitive decline. Over the years, I've seen what works, what doesn't, and what can quietly cause damage when no one's paying attention. I created this channel because I believe every senior in America deserves honest, clear, practical health information. Not watered-down advice, and not information buried in medical journals that nobody reads. What I'm sharing today comes directly from what I've learned in clinical practice, from the research I study, and from the patients who trusted me with their care. This is not meant to replace your doctor, but it is meant to give you the information you need to have a much smarter conversation with your healthcare provider, because knowledge is protection. And today, I want to protect you. Let's start with number 1. The first vitamin is vitamin E at high doses. Vitamin E is one of the most beloved antioxidant supplements in America. Walk into any pharmacy, and you'll see it prominently displayed. For decades, health magazines celebrated it as a heart protector, a skin healer, a cancer fighter. Millions of seniors take it every single day. And here's what most of them don't know. A major clinical study, one of the largest ever conducted on vitamin supplements, found that high-dose vitamin E supplementation actually increased the risk of death from all causes in older adults. Not decreased it. Increased it. Let me tell you about a patient I'll call Robert. Robert was 68, retired, sharp as a tack. He came to me because he was having unusual bruising, little purple spots appearing on his arms for no reason. He wasn't bumping into things. He wasn't falling. The bruises were just appearing. When I reviewed his supplement list, and it was a long list, there it was. Vitamin E, 800 IU daily. He'd been taking it for 3 years because a friend told him it was good for his heart. Here's what was happening. At high doses, vitamin E acts as a blood thinner. It interferes with vitamin K, the vitamin responsible for proper blood clotting. For a younger person with no other health issues, this might be manageable. But Robert was also taking a low-dose aspirin every day, which his cardiologist had recommended. The combination of high-dose vitamin E plus aspirin created a bleeding risk that was showing up as those mysterious bruises. If Robert had been on a full blood thinner, like warfarin or one of the newer anticoagulants, the consequences could have been far more serious than bruising. But here's where things get even more important. Research has also shown that high-dose vitamin E may interfere with chemotherapy and radiation therapy, making treatments less effective for people dealing with cancer. And in men specifically, large studies have found a potential link between high-dose vitamin E supplementation and increased risk of prostate cancer. Now, does this mean you should throw away all your vitamin E? No. The key word here is dose. The recommended dietary allowance for adults is just 15 milligrams per day. That's about 22 IU. Many supplement bottles contain 400 IU, 800 IU, even 1000 IU. That's up to 45 times the daily requirement. Food sources of vitamin E, nuts, seeds, olive oil, leafy greens, are perfectly safe and genuinely beneficial. It's the high-dose supplemental form that creates risk. If you're currently taking vitamin E supplements, I want you to check the dosage today and bring it up with your doctor at your next visit. The second vitamin is vitamin A, specifically the preformed version. Vitamin A is essential. Without it, you'd lose your vision. Your immune system would collapse. Your skin would deteriorate. There's no question this vitamin is critical to life. But after 60, there's a critical distinction your body makes that most people never hear about, and it involves two completely different forms of vitamin A. The first form is called beta-carotene, found in orange and yellow vegetables like carrots and sweet potatoes. Your body converts beta-carotene into vitamin A only as needed, so it self-regulates. Safe. The second form is called preformed vitamin A, also called retinol, found in animal products like liver and eggs, and in many multivitamins and supplements. This form doesn't self-regulate. Your body absorbs it directly, and it accumulates. Here's why this matters so much after 60. As we age, liver function naturally slows. The liver is responsible for processing and storing vitamin A. When liver function is reduced, even mildly, preformed vitamin A builds up in the body faster than it can be cleared. What does too much vitamin A look like? The early signs are easy to miss: headaches, dizziness, nausea, blurry vision. But chronic excess builds silently and leads to something that no senior wants: bone fractures. Multiple studies have found a clear association between high-performed vitamin A intake and reduced bone mineral density, meaning weaker bones that break more easily. For seniors already concerned about osteoporosis, this is a serious problem. I think about a patient I'll call Evelyn. She was 72, active, took excellent care of herself. She came in after a fall. What should have been a minor stumble resulted in a wrist fracture. Her bone density scan revealed osteopenia. But she was taking calcium, vitamin D, doing everything right. When we went through her supplements carefully, we found she was taking a multivitamin that contained 3,000 IU of preformed vitamin A, plus a separate vision health supplement that added another 2,500 IU. She was getting more than 5,000 IU of preformed vitamin A every single day, far exceeding safe limits, without ever knowing it. The lesson here is that vitamin A toxicity often hides in combinations. Multiple products each containing moderate amounts that add up to a dangerous total. If you take a multivitamin plus any additional supplements, I want you to look at the vitamin A content on each label today. If it lists vitamin A as retinol or preformed vitamin A, add up the numbers. Anything consistently above 3,000 IU per day for a senior is worth discussing with your doctor. The third vitamin is vitamin D, at megadoses. I can already hear some of you thinking, wait, Dr. William, isn't vitamin D good for seniors? Don't most doctors recommend it? And the answer is yes and yes. Vitamin D deficiency is genuinely common in older adults. Appropriate supplementation is absolutely beneficial. Vitamin D supports bone health, immune function, muscle strength, and even mood. But here's what nobody tells you: more is not better. And with vitamin D, more can be genuinely dangerous. Vitamin D is what's called a fat-soluble vitamin, unlike water-soluble vitamins, like vitamin C or B vitamins, which your body flushes out when you have too much. Fat-soluble vitamins accumulate in your body's fat tissue and organs. They don't flush. They build. Over the past several years, I've seen a dramatic increase in something called vitamin D toxicity, also called hypervitaminosis D, largely because well-meaning doctors and patients started reaching for very high doses without regular blood monitoring. What happens when vitamin D builds up too high in your system? It causes your body to absorb too much calcium from your food, and excess calcium in the bloodstream, a condition called hypercalcemia, is profoundly dangerous, especially for seniors. Hypercalcemia can cause kidney damage, including kidney stones and, in severe cases, kidney failure. It can trigger dangerous heart rhythm abnormalities. It causes confusion and cognitive problems. It causes constipation, nausea, and muscle weakness. And it can calcify arteries, literally depositing calcium inside your blood vessel walls, worsening cardiovascular disease. I had a patient, a 74-year-old man I'll call Walter, who came in complaining about confusion, severe fatigue, and what he described as brain fog that just won't lift. His daughter was with him, genuinely frightened. She said he'd been getting more forgetful, more confused, for months. She was worried about dementia. When we ran his blood work, his calcium level was dangerously elevated. His vitamin D level was extremely high. It turned out his previous doctor had prescribed 10,000 IU of vitamin D daily, a common high-dose protocol, but had never followed up to check his blood levels. Walter had been taking it faithfully for over a year. Once we safely reduced his vitamin D and his calcium normalized, the dementia symptoms disappeared almost entirely. He wasn't losing his mind. He was experiencing vitamin D toxicity. And by the way, I want you to drop a comment below and let me know. Are you currently taking vitamin D? And do you know your blood level? I ask because I genuinely want to know how many people watching this have actually had their levels tested. For most seniors, 1,000 to 2,000 IU of vitamin D3 daily is a reasonable maintenance dose. Some people need more, but that should be determined by a blood test, not guesswork. If you're taking more than 4,000 IU per day without recent lab monitoring, please talk to your doctor about getting tested. The fourth vitamin is vitamin K, and this one is critical for anyone on blood thinners. Vitamin K has had a remarkable surge in popularity over the past decade, and for good reason. Research connecting vitamin K to bone health, arterial health, and even brain function is genuinely compelling. Many seniors have started taking vitamin K2 supplements specifically for heart and bone support. But here's where a dangerous mistake gets made. One I see repeatedly, and one that can have life-threatening consequences. If you are taking warfarin, also known by the brand names Coumadin or Jantoven, vitamin K is your medication's direct opponent. Warfarin works by blocking vitamin K's role in blood clotting. That's the entire mechanism. Vitamin K makes your blood clot. Warfarin prevents that clotting. Doctors prescribe warfarin to reduce stroke risk, to treat clots, to protect people with artificial heart valves and atrial fibrillation. When you take a vitamin K supplement, even a moderate dose, you are potentially neutralizing your blood thinner. You are decreasing warfarin's effectiveness. And if your blood clots when it's supposed to be prevented from clotting, the result can be a devastating stroke or a dangerous blood clot in the lungs. The other side of this coin is equally dangerous. If you've been taking vitamin K supplements and you suddenly stop, warfarin suddenly becomes more powerful. And now your blood may thin too much, leading to serious internal bleeding. Both scenarios are real. Both can be fatal. And the tragedy is that they're completely preventable. Now, there are newer blood thinners called direct oral anticoagulants, apixaban, also known as Eliquis, rivaroxaban, also known as Xarelto, and dabigatran, also known as Pradaxa. These work through a different mechanism than warfarin, so they don't have the same direct vitamin K interaction. But they still require caution with supplements, so always check with your doctor. The rule is simple. If you are on any blood-thinning medication, including aspirin at higher doses, you must tell your doctor before starting any vitamin K supplement. Do not assume it's safe because it's a vitamin. Most people on warfarin are instructed to keep their dietary vitamin K intake consistent, not to eliminate it, but to keep it steady. Supplements, however, can introduce dramatic changes. Consistency is protection. And now we come to the fifth vitamin, the one that surprises people most. This one changed significantly in recent years, based on research that most people haven't heard about yet. It's niacin, also known as vitamin B3, at high doses. Niacin is a B vitamin. For decades, high-dose niacin was one of the most widely used therapies for raising HDL cholesterol, the good cholesterol. Doctors prescribed it. Cardiologists recommended it. And over-the-counter high-dose niacin supplements became enormously popular among seniors trying to manage their cholesterol. Here's what the research revealed, and this is critically important. A major clinical trial called the AIMH study found that high-dose niacin did not reduce heart attacks, strokes, or cardiovascular deaths, even when it successfully raised HDL levels. And more troubling, a subsequent trial called HPS2 THRIVE found that high-dose niacin actually increased serious adverse events, including dangerous infections and bleeding in the brain. And then, research published in a leading medical journal reported that a breakdown product of niacin, a metabolite called 4-PY, was associated with significantly increased risk of cardiovascular events, including heart attacks and strokes. This finding turned the conventional wisdom about niacin and heart health completely upside down. I think about a patient I'll call Donna. Donna was 66, sharp, health conscious. Her cholesterol numbers weren't where she wanted them, and she'd read online that high-dose niacin could help. She started taking 1,500 milligrams per day, a common therapeutic dose she'd found recommended in an article from several years ago. Within a few months, Donna noticed that her blood sugar had risen significantly. She'd never had a blood sugar problem before. High-dose niacin can increase insulin resistance, raising blood sugar in ways that can push people toward diabetes. She also developed painful flushing, liver function abnormalities on her blood work, and stomach issues. When she came to me, we stopped the niacin and her blood sugar began normalizing. But it was a frightening few months, and entirely unnecessary. The important distinction here is dosage. The niacin found naturally in food, turkey, chicken, fish, peanuts, is absolutely safe and beneficial. You need niacin. But the high-dose supplemental form, 500 milligrams, 1,000 milligrams, 1,500 milligrams or more, carries real cardiovascular and metabolic risks, especially for seniors. If you are currently taking high-dose niacin or extended-release niacin supplements, I want you to bring this up with your cardiologist or primary care doctor at your very next visit. Ask specifically about the recent research. Ask whether this is still the right approach for you given everything we now know. So we've gone through all five. High-dose vitamin E, preformed vitamin A, megadose vitamin D, vitamin K for those on blood thinners, and high-dose niacin. And I want you to notice the common thread running through every single one of these. In almost every case, the danger isn't the vitamin itself. The danger is the dose, combined with age-related changes in how your body processes nutrients, combined with the medications most seniors are already taking. None of these vitamins are evil. None of them should be universally avoided. But every single one of them can cause real harm when taken at high doses, without medical guidance, without monitoring, and without understanding how your body changes as you get older. Here's what I want you to do right now, today, before this video ends. Step 1. Go to your medicine cabinet and make a list of every supplement you're taking. Write down the name and the dose. Step 2. Check for these 5 vitamins. Vitamin E, vitamin A, look for the word retinol or performed on the label, vitamin D, vitamin K, and niacin or B3. Step 3. Add up the totals. Remember, many multivitamins contain the same vitamins that are in your individual supplements. The dangerous levels are often reached through accumulation, not a single product. Step 4. Bring that list to your doctor. Not to be told to stop everything, but to have an informed conversation. A good doctor will review your list and help you understand what's appropriate for your specific health situation, your medications, and your lab values. And step 5. If you're taking vitamin D and haven't had your blood level tested in the past year, ask for that test. It's a simple blood draw. It's called a 25-hydroxyvitamin D test. It gives you and your doctor the information you actually need to dose it correctly. I want to be very clear about something. I'm not telling you to stop all your supplements. Appropriate supplementation, guided by real information about your individual needs, can genuinely support your health. The goal is informed supplementation, not fear and not blind faith. One thing I've observed over years of practice is that patients often feel embarrassed or even guilty bringing up their supplements with their doctor, as if they've been caught doing something wrong. Some worry their doctor will dismiss them or lecture them. Please don't let that stop you. Your supplement list matters as much as your medication list. Both affect your health. Both can interact with each other. And any doctor who doesn't take your supplement list seriously is not giving you the complete care you deserve. If you're not sure how to start that conversation, try this. Doctor, I've been reading about how some vitamins can interact with my medications, especially at my age. Can we go through my supplement list together? That simple question could protect you in ways you don't even know yet. I've had patients tell me that reviewing their supplements led to better blood pressure control, improved blood sugar, resolved mysterious symptoms, and even prevented what could have been a dangerous drug interaction. This conversation has real consequences. You deserve that conversation. You deserve that information. And you deserve to take your health into your own hands, with knowledge, not just hope. Before I go, I want to ask you something. Leave me a comment and tell me, which of these 5 vitamins surprised you the most? And how old are you? Are you in your 60s, 70s, 80s? I read every single comment, and I genuinely want to know what's most helpful for the people watching this channel. Now, if you found this information valuable, there is a video I recorded that I believe is equally important for anyone watching this. Because while we've talked today about what not to take without guidance, there are supplements that have genuinely strong evidence for supporting heart health, brain function, and healthy aging after 60. Evidence-based, safe, often overlooked. In that video, I go through the supplements I actually recommend reviewing with your doctor, the ones with the best science behind them, the right doses, and the right timing. And I explain exactly why certain combinations work better together than separately. There's also something in that video that I want every single person with a family history of heart disease or stroke to hear, because it involves a simple morning habit that most cardiologists don't discuss during routine appointments, but that the research suggests may genuinely reduce cardiovascular risk. If you're serious about your health, and I know you are, because you've watched this entire video, then that next video was made specifically for you. It's right there waiting for you. I'll see you in it.